Are you struggling with painful sex and looking for answers? In this video, we are going to talk about the different types of painful sex, the common causes of painful sex, and how to get a proper diagnosis and discuss effective treatments to help you get back to a comfortable and enjoyable intimate life. Hello guys, my name is Dr. Raisha and this is the fertility series with Dr. Raisha. Pain during sexual intercourse is more common than you think. It happens to both men and women, but is more common among women, with about 7 to 22% of women experiencing painful sex at some point in their lives. It has a medical term and is called dyspareunia. But before that, let us try and understand the anatomy of down there, because trust me, there is more going on down there than you think. Most of us tend to think that everything down there is the vagina. Well, hold on, sister. Let me blow your mind for a second. Do you see this? This fluffy bit at the top? That is called the mons pubis. You know, the place where hair decides to grow for no reason. And then we've got this little thing that looks like a button here. That is the clitoris. This tiny little hole right here is the urethral opening. That is where urine comes out. So let us clear this up once and for all. Urine does not come out from your vagina. Moving on, the next opening is the vaginal opening. Now, here is the kicker. You can't even see the vagina itself. It is like a secret tunnel, and this is the doorway. The space between the vagina and the anus is called the perineum. All of these body parts together, they make up the vulva. So everything you see down there is the vulva, not the vagina. Got it? Good. Now, on to pain during sex. Two things could cause pain during sex. The first could be physical causes such as medical conditions, an injury to the vagina or the urethral opening. The second could be emotional causes such as anxiety or trauma. You know, the stuff that makes your brain and body not want to cooperate. But let's start with the physical causes. There are two types of pain during sexual intercourse. We have superficial pain and deep pain. Superficial pain is when you are feeling pain right at the opening of the vagina. This is usually felt during penetration, you know, when the penis is entering the vagina. It is like a rude doorman that will not just let you in. This pain can feel anything from stinging, throbbing, or even a sharp jab. And what is causing it? It could be an injury to the vagina itself, the clitoris, the urethral opening, or the vaginal lips. Yes, all of these parts are potential culprits. Now, when we are talking deep pain, we mean deep. You feel it way up inside, high in the vagina and low in your stomach, in the pit of your stomach. You feel it during the action as the thrusting happens. Let's look at the common causes of superficial pain. The most common cause of pain during sex is vaginal dryness. Yep, when there is not just enough lubrication in the mix, things can get uncomfortable. Now, this happens when the vagina is not producing enough moisture. And why? Well, one of the biggest reasons is lack of adequate foreplay. Maybe you are not aroused or excited. Yeah, if you are not there yet, your body is not going to be there either. So, if things are moving too fast without proper foreplay, your body may not have enough time to catch up. Vaginal dryness is also caused by low estrogen levels, and this is very common when women hit menopause, after childbirth, or in breastfeeding mothers. Lower estrogen means less natural lubrication, and it can make things feel pretty dry down there. So some medication could also lead to vaginal dryness. Things like birth control pills, antihistamines, antidepressants, and many more can mess with the body's natural lubrication. They leave you high and dry. You don't need to remember all of them. I'll give you a handy list in a second. Just grab a screenshot when you're ready. Another cause of painful sex is infections that cause inflammation around that area. One is a UTI, that is a urinary tract infection. When you have a UTI, this opening can be inflamed and sex causes friction in that area, leading to pain. Another one is a vaginal yeast infection or vaginal thrush. Thrush causes sores or splits on the lips of the vagina. Look at it this way. Now, you have some sores on the vaginal lips and the penis is trying to get in. So, it is rubbing against these sores, causing superficial pain. Another is genital warts. Genital warts can cause irritation, swelling, or tenderness in the genital area. During sex, friction against these warts can lead to discomfort or a burning sensation and hence making sex painful. The next cause is vaginismus. Now, this is a condition where the muscles around the vagina tense up so much that they essentially close off the vaginal opening. Think of it like your body saying, no, not today. It makes it really difficult, sometimes impossible for the penis to enter. And let's be real, if it can't get in, sex is not happening. It is very common, especially if it is your first time, or maybe you are just anxious or tensed for some reason. It is something that you cannot control. Your muscles are acting up on their own. In more severe cases, vaginismus can be so intense that nothing can enter the vagina. Even simple things like inserting a tampon or using a speculum during a gynecological exam can be impossible. Another cause of painful sex is injury to the genital area. Many women report discomfort after childbirth, often due to a vaginal tear or an episiotomy, which is a surgical cut that could be made during delivery. The healing process can leave that area sensitive, making sex uncomfortable. Another source of injury could be too much friction during sex, which can lead to small tears and cause pain during sex. Then there is the issue of vaginal products. Some of these fancy washes and creams contain ingredients that are not so kind to your delicate area down there. They can cause inflammation, irritation, or even vaginal dryness, which, as we have seen, can lead to painful sex. It is always important for you to be mindful of what you are using down there. Another potential cause of painful sex involves structural issues that a person may be born with, such as an imperforate hymen. Normally, the hymen surrounds the vaginal opening but leaves it partially open. However, in rare cases, the hymen may completely or partially block the vaginal opening, making penetration difficult or even painful. In cases where the vaginal opening is too small or entirely closed, it can cause significant discomfort during sexual intercourse. Another cause is skin conditions such as eczema or dermatitis. Eczema can cause the skin around the vulva or the vaginal opening to become inflamed, itchy, or irritated. Now, this makes the skin more sensitive and prone to discomfort or pain during sexual intercourse, especially due to friction during penetration. What about deep pain? This could be caused by medical conditions affecting the pelvic region. These are conditions such as fibroids. Fibroids are non-cancerous growths that grow inside the uterus. It could be a single fibroid or multiple fibroid, making the uterus a bit bulkier or heavier than usual. During sex, the penis is pressing against the cervix. And you see, the uterus is right there, and this here is the cervix. So the penis is pressing against the cervix. Okay, and this tends to shake the uterus. So this shakes the uterus, which in this case is heavier and bulkier than usual, hence leading to pain. Another one is ovarian cysts. These are fluid-filled sacs that develop inside the ovaries. And during sexual intercourse, now the ovaries get shaken up. This leads to pain. Another cause is endometriosis, which is a condition whereby the uterine lining goes and implants itself in other pelvic organs outside the uterus, such as the ovaries, the fallopian tubes, or the bowel. And this can make sex to become really painful. We said that UTIs can cause superficial dyspareunia when the urethral opening is inflamed, but sometimes UTIs can make the bladder inflamed, leading to what we call cystitis. Now, the bladder sits below the uterus like this. This is the uterus, and the bladder now sits somewhere below the uterus like that. And during sex, the penis is hitting against the cervix, and this is shaking the uterus, and it is shaking the bladder that is below it, and this can lead to pain during sexual intercourse. Another one is pelvic inflammatory disease. Now, this is a condition where organs of the pelvic region, that is the uterus, the fallopian tubes, the ovaries, are inflamed. Pelvic inflammatory disease happens when an STI goes untreated for so long, and this inflammation leads to pain during sexual intercourse. Next is medical surgeries and treatments such as radiotherapy on areas of the pelvic region such as the ovaries, the uterus, and the fallopian tubes. Now, these procedures leads to scar tissues and adhesions in these organs, making them stick together. And now this limits movement. And so during the thrusting and the shaking up of the uterus during sexual intercourse, this movement makes it very painful during sex. Now, let us look at the emotional causes of painful sex. Look at it this way. It is all about the mind. If you have experienced past traumas around sex, maybe sexual violence or even rape, it becomes very hard for you to find sex pleasurable. If you are mad at your partner for some reason, you will find it hard getting aroused. Our brains are wired to shut down desire when emotions run high. Or maybe you have stress, depression, or anxiety. When your brain is in overdrive, it is hard for your body to relax, especially those vaginal muscles. Now, they just tighten up, and suddenly sex becomes more painful than pleasurable. So, you have been experiencing painful sex and you decide to visit your gynecologist, which is a great move. The key to figuring out what is causing the pain is understanding its nature. Your gynecologist will need detailed information to pinpoint the issue. They will need to know the specifics to help them diagnose the underlying cause and guide you towards the right treatment. We will need you to answer a lot of questions like, do you feel pain as the penis penetrates the vagina, or is it during the thrusting stage? Where exactly do you feel the pain? Is it at the vaginal opening, the clitoris, or the urethral opening? Does the pain occur every time you have sex or only sometimes? How long have you been experiencing pain during sex? Is the pain constant or does it come and go? How severe is the pain on a scale of 1 to 10? Does the pain change with different sexual positions? Do you feel the pain outside of sexual intercourse, e.g. when inserting tampons? So be ready to answer all these questions. Don't look at it like the doctor wants to know so much about your intimate life. The doctor is invading your sexual life. No, we need to know all this to understand what exactly is causing this pain. The doctor will also want to do a gynecological examination by inserting a speculum inside the vagina to visualize the cervix and also to look at the walls of the vagina. Are there any injuries on the vaginal walls? They could also insert fingers, and try to feel organs such as the ovaries. Are they enlarged or bulkier than usual? And also, an ultrasound can help us see if you have fibroids or cysts. And now, on to treatment of painful sex. As you have seen, a lot of things and conditions can cause painful sex. You cannot treat painful sex without exactly knowing what is causing it. So, it is very important for you to see a gynae. Do not be embarrassed. If the painful sex is caused by vaginal dryness, then we can use estrogen replacement therapies such as estrogen pills, estrogen vaginal creams, estrogen vaginal inserts. We could also choose to use a lubricant, but you need to be very careful as you select these lubricants. You need a water-based lubricant such as KY jelly or a silicone-based lubricant. But you need to avoid these petroleum or oil-based lubricants as they can cause irritation, hence worsening the situation. Oil-based lubricants could also degrade a condom, specifically the latex condom, basically making them useless. If the pain is caused by infections such as UTI or vaginal thrush, the solution is to treat the infection. We could use antibiotics for the UTI or antifungals for the yeast infection. If underlying conditions such as fibroids, cyst or endometriosis are the culprits, then treatment may involve medication or in some cases surgery to address the root cause. For emotional causes such as stress or past trauma, it is very important to seek help from a therapist who can guide you through these emotional challenges. Dealing with both physical and emotional aspects can help bring relief and make sex or intimacy more enjoyable. Some women also experience pain during certain sexual positions, especially those that allow for deep penetration, like doggy style, reverse cowgirl. You know them. Now, if you find that the discomfort only happens in a specific sexual position, it is a good idea to talk with your partner and explore other sexual positions that might be more comfortable for you. Communication is key, right? Another common issue is skipping adequate foreplay. If you're rushing things, your body might not be fully ready. So take your time to enjoy foreplay, to build arousal, and let your body naturally prepare for the fun ahead. The more relaxed and lubricated you are, the less likely you will experience discomfort during sexual intercourse. Now, on to the best sexual positions and when and how many times you should have sex to get pregnant. I am going to leave that video over there. But don't click on it just yet. Please subscribe if you want to keep learning more with Dr. Raisha. Okay? See you over there.